section of the ear canal. It's not visible yet, but during the course of the procedure, you'll see some damp, dead skin collecting on the anterior canal walls of the front part of the ear canal. And underneath that, there is some granulation tissue. So granulation tissue is inflammatory tissue, so your body produces it as part of the healing process sometimes. And it's essentially connective tissue, which undergoes a process called neovascularization. So it forms its own blood supply, has its own blood capillaries. And granulation tissue looks quite fleshy. It's quite bumpy, it's quite red because it has got this neovascularization. And when you remove granulation tissue, and sometimes you're not aware that you're even removing it because it's hidden away, you rupture these blood capillaries. So you do get some localized bleeding. And I was worried initially, did I cut this patient? But at no stage did I feel I did. The patient at no stage felt uncomfortable. And then it was only later that I realized there was some granulation tissue present, and that was the cause of some of this blood. So I'm using a combination of microsuction and the Ride-Correct. Given the consistency, however, of this wax, although the Ride-Correct did remove quite a substantial amount here, it was also smearing, smudging some of it at the floor of the ear canal. So I'm going to revert back to microsuction in a moment. Now this patient suffers from really dry, itchy ears. You'll see, as we're entering the concha bowl, so the concha bowl is this part of your ear, and you can subdivide the concha bowl. You've got the cavum concha, which is the main bowl of the body, at the bottom, sorry, can't get my words out, and the cymba concha, which is the top section over here. So that part of this patient's ear is very, very dry. So they may have a bit of eczema. I've just advised this patient to use on a regular basis some medical grade olive oil spray. And you can see some of this dry skin at the floor of the ear canal that's enveloped itself around the wax plug and it's still attached to the canal wall. And just on a weekly basis, so the way I've instructed the patient to use the olive oil is to tilt the head to the side, so the ear that they're putting it in is facing towards the ceiling, squirt out a couple of drops, or three or four, let it sit for a few minutes.